Real exam mental health binge eating practice. Question 1. Which chronic medical condition commonly triggers major depressive disorder? Option A, pain. Option B, hypertension. Option C, hypothyroidism. Option D, Crohn's disease. The correct answer is option A, pain. Chronic medical conditions can significantly impact mental health, often serving as triggers for major depressive disorder (MDD). The correct answer is a pain, as chronic pain is one of the most well-documented. Question 2. Which drug group requires nursing assessment for the development of abnormal movement disorders in individuals taking therapeutic dosages? Option A, SSRIs. Option B, antipsychotics. Option C, benzodiazepines. Option D, tricyclic antidepressants. The correct answer is option B, antipsychotics. Antipsychotics choice B are the correct answer because they are strongly associated with the risk of extrapyramidal symptoms (EPS) and other movement disorders due to their dopamine receptor blockade in them. Question 3. What information should the nurse provide in patient education for a patient-prescribed sertraline for major depressive disorder? Option A. Take the medication with food. Option B. It may take several weeks to feel the full effect. Option C. Avoid consuming grapefruit while taking this medication. Option D. Regular blood tests are necessary to monitor levels. The correct answer is option B. It may take several weeks to feel the full effect. Patients prescribed sertraline for major depressive disorder should be educated that it may take several weeks before experiencing the full therapeutic effects of the medication. This delay in onset of action is. Question 4. What principle about patient-nurse communication should guide a nurse's fear of saying the wrong thing to a patient? Option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. Option B. Patients are more interested in conversing with you than in hearing your perspective, making offense unlikely. Option C. Considering the patient's background, the likelihood of the comment causing harm is minimal. Option D. Individuals with mental illness often possess a heightened capacity for forgiveness. The correct answer is option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. The correct answer is A. Patients value interactions with healthcare providers who express genuine acceptance, respect, and concern for their well-being. By focusing on conveying these qualities, a nurse can help. Question 5. When explaining suicide precautions to a client, what would be the best explanation? Option A. You need to control yourself. If you cannot, we will do it for you. Option B. This can seem embarrassing, but we want you to be safe. Option C. You will stay on these precautions for 1 week. Option D. When you feel you are safer, then we will not need to observe you. The correct answer is option D. When you feel you are safer, then we will not need to observe you. Choice D provides a supportive and empowering explanation to the client on suicide precautions. It emphasizes the client's own sense of safety and control, indicating that the observation is temporary and can be. Question 6. Which of the following medications is commonly used to treat attention deficit/hyperactivity disorder, ADHD? Option A. Haloperidol. Option B. Fluoxetine. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant commonly used in the treatment of ADHD. It helps improve focus, attention, and impulse control in individuals with ADHD. Haloperidol and clozapine are. Question 7. Which of the following is a common side effect of benzodiazepines prescribed for anxiety? Option A. Insomnia. Option B. Weight gain. Option C. Drowsiness. Option D. Increased appetite. The correct answer is option C. Drowsiness. Drowsiness is a common side effect of benzodiazepines prescribed for anxiety. Benzodiazepines work by depressing the central nervous system, which can lead to drowsiness as a side effect. This sedative effect is. Question 8. Tammy, a 28-year-old with major depressive disorder and bulimia nervosa, is ready for discharge from the county hospital after 2 weeks of inpatient therapy. Tammy is taking citalopram, Celexa, and reports that it has made her feel more hopeful. With a secondary diagnosis of bulimia nervosa, what is an alternative antidepressant to consider? Option A. Fluoxetine, Prozac. Option B. Isocarboxazid, Marplan. Option C. Amitriptyline. Option D. Duloxetine, Cymbalta. The correct answer is option A. Fluoxetine, Prozac. Fluoxetine Prozac is a suitable alternative antidepressant for Tammy due to its approval for the treatment of bulimia nervosa. It belongs to the selective serotonin reuptake inhibitor (SSRI) class of. Question 9. Natasha's husband died suddenly 2 months ago, and she has been overwhelmed with grief. When Natasha is subsequently diagnosed with major depressive disorder, her daughter, Nadia, makes which true statement? Option A. Depression often begins after a major loss. Losing dad was a major loss. Option B. Bereavement and depression are the same problem. Option C. Mourning is pathological and not normal behavior. Option D. Antidepressant medications will not help this type of depression. The correct answer is option A. Depression often begins after a major loss. Losing dad was a major loss. When individuals experience a significant loss, such as the death of a loved one, it can trigger major depressive disorder. This is because the intense grief and sadness associated with the loss can lead to the Question 10. To provide effective care for the patient diagnosed with schizophrenia, the nurse should frequently assess for which associated condition. Select one that doesn't apply. Option A. Alcohol use disorder. Option B. Major depressive disorder. Option C. Stomach cancer. Option D. Polydipsia. The correct answer is option C. Stomach cancer. Schizophrenia is often associated with comorbid conditions such as alcohol use disorder, major depressive disorder, polydipsia, and metabolic syndrome. Stomach cancer is not a common associated condition with. Question 11. Which characteristic in an adolescent female is sometimes associated with the prodromal phase of schizophrenia? Option A. Constantly afraid another student will steal her belongings. Option B. An unusual interest in numbers and specific topics. Option C. Demonstrates no interest in athletics or organized sports. Option D. Appears more comfortable among males. The correct answer is option B. An unusual interest in numbers and specific topics. During the prodromal phase of schizophrenia, individuals may exhibit subtle changes in behavior or interests. An unusual interest in numbers and specific topics may be a sign of cognitive disturbances that can. Question 12. A healthcare professional is teaching a patient about relaxation techniques to manage anxiety. Which technique is the healthcare professional most likely to recommend? Option A. Deep breathing exercises. Option B. Physical exercise. Option C. Mindfulness meditation. Option D. Journaling. The correct answer is option A. Deep breathing exercises. Deep breathing exercises are a widely recommended technique for managing anxiety and promoting relaxation. By focusing on deep, slow breaths, individuals can activate the botus relaxation response, leading to. Question 13. When caring for a patient with major depressive disorder prescribed an MAOI, what type of food should the nurse educate the patient to avoid? Option A. High-protein foods. Option B. High-fiber foods. Option C. Tyramine-rich foods. Option D. Low-fat foods. The correct answer is option C. Tyramine-rich foods. Patients prescribed MAOIs need to avoid consuming tyramine-rich foods as these can lead to hypertensive crises. Tyramine is found in various foods like aged cheeses, cured meats, some types of beer, and fermented. Question 14. During pregnancy, a woman is in a relationship with a male who routinely abuses her. Her unborn child may engage in high-risk behavior as a teen as a result of. Option A. Maternal stress. Option B. Parental nurturing. Option C. Appropriate stress responses in the brain. Option D. Memories of the abuse. The correct answer is option A. Maternal stress. Maternal stress during pregnancy can have long-term effects on the child's behavior and stress responses. Research shows that exposure to high levels of stress hormones in the womb can influence the developing fetal. Question 15. Which mood stabilizer is commonly prescribed for bipolar disorder? Option A. Sertraline. Option B. Lithium. Option C. Clozapine. Option D. Haloperidol. The correct answer is option B. Lithium. Lithium is a well-established mood stabilizer commonly prescribed for the treatment of bipolar disorder. It helps to control manic episodes, stabilize mood swings, and reduce the risk of relapse in individuals with. Question 16. Which intervention is most appropriate for a patient with a phobia of flying? Option A. Exposure therapy. Option B. Cognitive restructuring. Option C. Medication management. Option D. Psychoeducation. The correct answer is option A. Exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case. Question 17. Which of the following therapies is considered the most effective for treating phobias? Option A. Cognitive behavioral therapy. Option B. Psychoanalysis. Option C. Medication management. Option D. Group therapy. The correct answer is option A. Cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is widely recognized as the most effective treatment for phobias. CBT helps individuals identify and change negative thought patterns and behaviors associated with their phobias. Question 18. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? Option A. A new psychiatrist is a chance to start fresh, I'm sure it will go well for you. Option B. You say you look forward to the meeting, but you appear anxious or unhappy. Option C. I noticed that you frowned and avoided eye contact just now. Don't you feel well? Option D. I get the impression you don't really want to see your psychiatrist. Can you tell me why? The correct answer is option B. You say you look forward to the meeting, but you appear anxious or unhappy. Choice B is the most therapeutic response as it acknowledges the discrepancy between the patient's verbal statement and nonverbal cues. By addressing both the patient's expressed anticipation and the conflicting. Question 19. Which statement made by a patient prescribed bupropion, Wellbutrin, demonstrates that the medication education the patient received was effective? Option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Option B. I'm happy to hear that I won't need to worry too much about weight gain. Option C. It's okay to take Wellbutrin since I haven't had a seizure in 6 months. Option D. I need to be careful about driving since the medication could make me drowsy. The correct answer is option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Choice A is the correct answer because it shows that the patient understands the dual benefits of bupropion Wellbutrin in treating depression and aiding in smoking cessation. Bupropion is commonly prescribed for. Question 20. In what order should the following goals be approached for a client being treated for alcoholism? Option A. Learning about dependence and recovery, abstinence and development of a support system, attaining physiological stabilization, developing alternative coping skills. Option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. Option C. Abstinence and development of a support system, attaining physiological stabilization, learning about dependence and recovery, developing alternative coping skills. Option D. Abstinence and development of a support system, learning about dependence and recovery, attaining physiological stabilization, developing alternative coping skills. The correct answer is option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. When treating a client for alcoholism, it is important to follow a structured approach to maximize treatment effectiveness. The correct order of approaching goals is to first help the client in developing alternative. Question 21. Which statement by the patient indicates a need for further teaching regarding the treatment of major depressive disorder? Option A. I have been on this antidepressant for 3 days. I understand that the full effect may take weeks to occur. Option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Option C. I may ask to have my medication changed to Wellbutrin due to the problems I am having being romantic with my wife. Option D. I realize that there are many antidepressants and it might take a while until we find the one that works best for me. The correct answer is option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Choice B indicates a need for further teaching because the patient is planning to switch directly from Prozac, an SSRI, to a monoamine oxidase inhibitor MAOI without allowing for a washout period. This abrupt. Question 22. A patient being treated for insomnia is prescribed Ramelteon, Rosarum. Which comorbid mental health condition would make this medication the hypnotic of choice for this particular patient? Option A. Obsessive-compulsive disorder. Option B. Generalized anxiety disorder. Option C. Persistent depressive disorder. Option D. Substance use disorder. The correct answer is option D. Substance use disorder. The correct answer is D. Substance use disorder. Ramelteon is preferred for patients with substance use disorder because it lacks abuse potential. This makes it a safer choice for individuals with a history of. Question 23. Which of the following is a common side effect of selective serotonin reuptake inhibitors, SSRIs? Option A. Hypotension. Option B. Sexual dysfunction. Option C. Increased appetite. Option D. Tachycardia. The correct answer is option B. Sexual dysfunction. Corrected rationale. Sexual dysfunction is a commonly reported side effect of selective serotonin reuptake inhibitors SSRIs. SSRIs can affect sexual function by causing issues such as decreased libido, delayed. Question 24. Child Protective Services have removed 10-year-old Christopher from his parents' home due to neglect. Christopher reveals to the nurse that he considers the woman next door his nice mom, that he loves school, and gets above average grades. The strongest explanation of this response is Option A, temperament. Option B, genetic factors. Option C, resilience. Option D, paradoxical effects of neglect. The correct answer is Option C, resilience. Christopher's positive outlook, strong school performance, and forming a bond with the neighbor indicate resilience. Resilience refers to the ability to adapt and thrive despite facing adversity, such as being. Question 25. A patient with schizophrenia is experiencing auditory hallucinations. Which nursing intervention is most appropriate? Option A, encourage the patient to ignore the voices. Option B, provide a structured and safe environment. Option C, engage the patient in a debate about the reality of the voices. Option D, ask the patient to describe the content of the hallucinations. The correct answer is Option D, ask the patient to describe the content of the hallucinations. The most appropriate nursing intervention when a patient with schizophrenia is experiencing auditory hallucinations is to ask the patient to describe the content of the hallucinations. This intervention helps assess